Hey guys, Dr. Pete here again from Precision Movement. Last time we talked with Ernie and we discussed shoulder pain. Today's focus will be on the knee. So if any of the viewers out there who are avid pickleballers and they're dealing with some knee pain, today will be broken up into 3 segments. The first segment is figuring out, okay, why do you have the knee pain? Depending on where your pain is, might be related to different causes or diagnoses. Second part will be some suggestions on how we can treat it. And then lastly will be some suggestions on how to provide a long-term fix to your knee problems. So let's talk about the first stage. So, the typical knee pain complaints, if we see it across the board, is usually front of the knee pain, right? A lot of people have developed, as they start to become more active, they start to maybe pick up pickleball without proper training or strength conditioning, then you start to rely a lot on your quadricep muscles, and therefore it starts to pull on the tendon. So of course the number one diagnosis that we see in physical therapy is tendinopathy or patellar tendonitis. So if your pain is in the front here, you might be dealing with a tendonitis type of issue, and we'll talk about how to deal with that later. If your pain is more on the inside or around the kneecap, then your issue might be more of a patella femoral pain syndrome, which just means the kneecap is either hitting the sides of the bony areas here. The patella, the way it sits, it's like a boat, and it sits in the crevice. So if your knee is wobbling back and forth, the boat actually might hit the sides, and therefore you might have irritation on the sides. So if you're having irritation on the sides, it might be more from the patella here. If you're dealing with more of an inside knee pain, that could be more of a joint compression type of issue, or just some tight muscles on the outside. So that could be related to, again, or treatment for that would be, of course, trying to address those certain areas, which we'll talk about later. Lastly, sometimes people have pain on the outside. So when you have pain on the outside, it could also be, again, some tight muscles or your poor movement creating some imbalances on the outside here. So on the next segment, we're going to talk about how to address these things here. Alright guys, so now let's talk about some simple tips and tricks that you can do at home to help with your knee pain. As always, get assessed by a physical therapist or by your doctor to make sure that there's nothing serious going on, of course. And once you're into and referred to physical therapy, we can definitely create a specific plan for you, whatever your diagnosis is, right? But let's talk about the first knee pain here. So if you're dealing with the tendonitis, the patellar tendinopathy, right in the front, it just means your tendon here is slightly inflamed. And that could be because, again, of overuse, overtraining, or perhaps some tightness in the muscles up here. Perhaps you're overusing these muscles, which is creating a pull on the tendon. So some simple tips for you at home, what you can do is, of course, if it's actively inflamed, what you can try and do is use an ice cube and just try to address the tendon, for about 2 to 3 minutes, just right on the tendon. Just move the ice cube around to help calm the pain down. Let's say you're past the first day or second day after the injury or the irritation. What you can start doing is then contrasting cold and heat to help bring more circulation. If you don't have those options, we of course have options as far as the massage devices to bring more circulation and relaxation to the area. So if you have access to one of these, give it a shot. It's, again, you're past the initial acute phase, you're more in the subacute phase, which would mean 3 to 5 plus days after injury or incident, and you can just literally just apply it right there to the tendon. The vibrations will bring circulation and, like I said earlier, relaxation to the tendons itself here. A lot of the name of the game is circulation, so you want to just bring in new blood, fresh blood, so that way things will heal. All right, very good. Perfect. So let's say you're dealing with more of the inside knee pain. Like I said before, depending on where it's at after a proper evaluation, if the pain is more inside the joint and you're just feeling a lot of a pinching pain, some tips that you can do is try to relax the muscles around it, from above it or below it, to give you a little bit more space so your muscles aren't contracting the joint and compressing it. So a simple tip would be, of course, using this muscle, this is the massage device, and attacking the muscle, which is right on the inside of the knee. So the inside quad here can be addressed like so. Yep, it's a little bit ticklish, but as your muscles start to relax and get used to the vibrations, it will help relax it as well. So your inside quad can be released. Your groin muscles, which are more on the inside here, can also be released, because what they do, they cross over the knee joint. So if it's tight, it can create some compressive stress right in the joint, right through there. Awesome. Of course, there are other mini structures inside here, but those are the common issues there. All right. So let's say again you're dealing with the outside knee pain. So if there's pain more on the outside here, what you can try and do is relax the muscles on the side here, which is tensioning the kneecap, and potentially pulling the kneecap that way, which is compressing the joint there. So simple tips would be, of course, using the same any massage device to help relax the outside of the knee. I would spend about a minute or two at each area that feels tender, like so. And I don't really move it around too much. I just let it work, let the muscles relax, and relieve some of the tension around there. Great. Perfect. So other options, of course, after evaluation and whatnot, and if this is appropriate for you, sometimes scar tissue builds up around the knee, so you can use some scraping tools just to kind of break up some of the scar tissue. We call it cross-friction massage to kind of any certain area. That way, just like your car and your parking brake, if you're driving and you leave your parking brake on, then it's hard to move, right? So what you want to do is release the parking brake by relaxing the muscles or areas that are restricted to allow you to move freely. And that's, I would suggest, a short-term tip and solution to some of your knee issues. All right, so the last portion here now, we're going to suggest some exercises and some long-term solutions to your knee pain. So as I previously mentioned before, if there's any irritated area, you want to calm it down, right? So whether it be the front, the outside, or the inside, there could be some areas of the body that are overused. So then the question is, why is this area being overused? Why is my quad being overused? Why are my groin muscles becoming overused, pulling pain here? Why is my IT band overused? And usually the number one issue is poor or inactivated glute muscles. So the glute muscles are obviously up here in the back of the hip. What they do is they actually control the position of your thigh bone here. And if you don't have a lot of control and activation through here, your knee has a chance to wobble, or the other muscles that are in the front, outside, or inside, or even the back might start to co-contract and take over the movement, therefore creating a lot of pressure in your knee. So the long-term solution to most knee issues is actually strengthening not at the knee itself, but strengthening the glutes up here. So I'm going to take Ernie through a simple glute activation exercise. So we're going to throw this band on. Perfect. And then we're going to go all the way up to the knee. There we go. So I like the band at the knee because it allows you and trains you to stabilize and control through your hip. All right. So he's sitting here. His knees are bent about 90 degrees. His hips are flexed about 45 degrees. His core muscles are engaged. And what you're going to do is keep your feet together and just slowly stretch the top knee away from the bottom knee. Okay, perfect. As far as you can without rolling your body backwards and holding that. All right, do you feel the glute muscles on the top there? Mm-hmm. Great, perfect. Should be back there, exactly, right. If you're having a tough time and you're doing this and you're not feeling in the backside, definitely reach out to us. There's some tips that we can do, such as bringing your knees, bringing your body a little bit straighter back, or rolling your hips more forward. But this, believe it or not, can be quite complex. So make sure you're doing this right. Number one, of course, you're holding the band, working on that full range. Number two, you're feeling it in your glute muscles, which is the backside muscle there. All right, go and relax. Good. All right, so that's the first one. Number two, another one that I like to give patients is we'll do a straight leg raise now. So bring it both forward. Hips are rolled forward. Keep the top leg straight, and you're going to lift the leg upwards and slightly backwards behind you, like that. Perfect. Ooh. Awesome. Yeah. Nice. Do you also feel back in the glutes there? Awesome. So a lot of people, when they do this leg raise, they just bring it straight up. When you bring it straight up, you can engage some of the hip flexors and some other muscles that we don't want to work. So that's why I cued him to bring the thigh and the whole leg straight back a little bit to engage the glute muscles. All right, go and relax. Great. All right, so those are two very common warm-ups that I would give people, and maybe they're pretty tough workouts, maybe not a warm-up.
Pulling them up and holding them, or up and down?
Yeah, so initially what I like to give people is definitely holding it. That way you can learn the position and feel the burn, feel the activation pattern. Once you're able to feel it and hold it for about a minute, then you can start repping it out, because athletics, of course, is movement. So you want to definitely work on the timing of the contraction rather than the hold. But the first step is, can you feel it? Can you hold it? Second step is, can you time it properly? All right, so come on and sit up. And alrighty, so the next drill, let's get you on your feet now, is still with the band. We're going to do a squat and hold, right? So let's say, again, you're a pickleball player or you're just a court player. What you can do is, what you tend to do is, of course, overuse your knees, right? For example, it would kind of look like when you're over the net or whatnot, you can kind of load your knees a lot. So you can imagine when you do that, you activate the front muscles here, which can create strain to your knee. So this drill is to break you out of that habit, to break you out of that behavior, and actually train your hips to work more. So we're trying to turn the dial up for your glutes to work more, and to turn the dial down on your quads.
Because yeah, we do a lot of squatting at the kitchen line.
Yes.
And you're holding that position for a long
time, right? And you have to move out of that position.
We're sliding back and forth, but we're down here.
Exactly.
You know, so jinking a lot. So.
Right. So this drill will be just a simple drill where you're holding the pose here, going squat. Keep your feet where they're at, but stretch out the band outward like so. So your feet are stable on the ground, they're planted. Your knees are outward, and you should feel now activation in your glute muscles. You feel that? Perfect.
Yeah.
Good. So this is, like I said, tipping the ratio to more glute activation than quad activation.
So it's this motion of
widening the knees.
Not my feet, but my...
Exactly. Not the feet, but the knees. Exactly.
Should my feet be a little closer than my shoulder? Or?
No, that's okay. Yeah, whatever your natural posture is at the line or at the net, you can get into that position.
So get in that position and then widen the knees.
Exactly. Yep. And then come on up. Great. Okay, cool.
I can feel that burn.
Yep, exactly. Great. Okay, so the next drill is, of course, that was two-legged. So a lot of athletic movement is actually on one leg, right? And obviously pickleball is not a lot of one leg, but if you can do one leg, you can actually build enough capacity and I guess build up your gas tank to be able to handle the sport a little bit better. So go and take the band off. I'm going to suggest one more drill, and we're going to use a chair right there. So what you're going to do is, go and step forward. You're going to put one foot on the chair there, like so. Exactly, perfect. So this is an advanced exercise, and this is for people who obviously are not dealing with an acute pain, but are working on maybe strength and conditioning, maybe trying to improve their performance. So just like we talked about before, most people will bend down just a little bit, bend and overuse their knee. So what I want to do is break out of that habit by bending your hips back, kind of sitting back into the glutes right here. Perfect. And do you feel that glute having to engage there? Perfect. Again, so the big tip is bending at the hips and engaging that glute muscle so that you don't overuse the muscles at your knee. Perfect. So let's do the other leg just to give them a visual look here. So
instead of just bending over like that, where I can feel pressure here, bending almost like I'm sitting backwards.
Yeah, sitting backwards, and you have to almost lean your shoulders forward too, like that.
Counterbalance.
To counterbalance, exactly. Perfect.
Okay.
So make sure, again, you're feeling in the right spot. You're feeling a lot of glute, and you're feeling minimal knee pain or even no knee pain back here, okay? And you can hold this for about a minute if you want to, just to start off, but eventually you can load it up, you can relax. Eventually you can do the reps, and you can start holding weights and really strengthen up your leg. And so if you can...
just holding it or doing reps up and down.
Yeah, so you can start with the hold just to kind of learn the position, learn the activation pattern, then eventually do reps to build up that power endurance for the sport. Yeah, exactly. You can have a seat there. Yeah, perfect. So again, number one tip, of course, is get evaluated by your doctor, your physical therapist, someone that specializes in sports movements. Then once you're able to get evaluated, as a physical therapist myself, we can create that specific program for you. Today was just general tips to help you deal with some pain. If you're stuck at home and just dealing with a lot of pain, those are some simple tips to try. If you're courageous enough to go to physical therapy, those are the things that we'll do. We'll evaluate you, we'll look at your knee, we'll give you a diagnosis as far as what's going on, and give you a short-term pain management solution, but also a long-term movement mechanics solution to not only get you pain-free, but to get you performing better,
Yeah.
right? And that's the main goal.
Yeah, yeah.
Because you want to start winning games, right? You want to start
sure.
moving better. So yeah,
Sure. Yeah.
great. All right, guys.
Great.
Thanks for listening. So the next episodes we'll probably be talking about the tendonitis issues in the Achilles, and also we'll talk about low back pain as well. So any questions at all, feel free to reach out to me. Again, my name is Dr. Pete. I'm a physical therapist at Precision and Movement. And all right, you guys have a good day.